Good afternoon, and thank you for joining us on Across the Fence. I'm Jolie Whitney. American Heart Month is an annual observance in February that raises awareness about heart disease, the leading cause of death in the United States. When it comes to this matter of the heart, we've brought in the best of the best. Dr. Mary Cushman is the Vice Chair of Medicine and co-director of the Vermont Center for Cardiovascular and Brain Health at the UVM Larner College of Medicine. She also leads the Thrombosis and Hemostasis program at UVM Medical Center, not to mention also being a University Distinguished Professor of Medicine and Pathology in the Robert Larner College of Medicine at UVM. Quite a lot of qualifications. Thank you so much for joining us today.
It's great to be here. Thanks for having me.
And we said it's the leading cause and it impacts men, women, most races as well. And 1 in 5 people in 2022 died of heart disease. So why is it so prevalent?
So this has been the pattern for decades, first off. And there's a couple of reasons why it's so prevalent as a cause of death. The first is that the risk factors are really common. And the second is that those risk factors are not always identified and treated. So you have this raging kind of uncontrolled risk that can go on for decades and lead you to developing an event. So the most common risk factor is high blood pressure or hypertension. And in older people, it's present in about 2/3 of people. And I always call it the silent killer because high blood pressure tends to not have any symptoms until you have a heart attack or a stroke. And that's a big problem. So unless you measure your blood pressure and get it checked, and then really sit down with your physician or advanced practice provider to come up with a treatment plan, then you have that ongoing risk that you don't even know about. The other risk factors are less common, but just as important. So diabetes, of course, the best way to deal with diabetes is to prevent it in the first place, which really involves a lifelong strategy of having sort of heart healthy habits like good levels of physical activity and a healthy diet with lots of fruits and vegetables. Smoking, of course, a common risk factor. Smoking is the leading preventable cause of death around the world. And it starts in childhood, unfortunately, when children get into cigarettes or vaping, and the vaping then leads to a lifetime of addiction to nicotine. And so for smoking, not starting in the first place is the best because it's very hard to quit. And then finally, high cholesterol as a risk factor, again, doesn't cause any symptoms, but over the years, it's attacking the inner lining of your arteries and leading to hardening of the arteries, which leads to heart attack or stroke. And unless you get the lab test and get it checked, you don't know you have it. And the treatments are highly effective and reduce the risk of death. So who wouldn't want to take a simple pill once a day for high cholesterol to reduce the chance they would die?
Sure.
So for sure, uncontrolled risk factors and lack of knowledge about the risk factors.
And talking about
really
those
critical.
The lack of knowledge you were mentioning, you chaired the last American Hospital Association survey of U.S. women and found out that awareness about heart disease is kind of declining. So why do you think that's happened?
Yeah, this was a big surprise. So I had this real honor in 2019 to lead this survey for American Heart, and compared to the prior survey that was done about 5 years before, women's awareness that heart disease was their leading killer, because it is the leading killer for men and for women, the awareness plummeted. It went from about 66%, the survey previous, to only 44%. So less than half of women even know this simple fact that heart disease is their leading cause of death. And it was especially the case for women of color and for younger women in their 20s and early 30s had the worst awareness. So we have a lot of work to do on that one. And that's part of why I'm talking to you today.
And we're happy to have you. And you've been studying cardiovascular health for years. So what have you learned about the disease from when you started to now?
Oh, so much has changed. When I first started, for example, the definition of hypertension or high blood pressure was a blood pressure above 160/90. And now it's a blood pressure over 140/90 because we better understand what levels of blood pressure are causing harm. And even if you're in the 130s for the top number, the systolic blood pressure, that's pre-hypertension. And so if you're in that range, you have to start working on getting it down. And so simple things like that have changed. And I started, most of my research is around measuring factors in the blood or the urine or the DNA that relate to risk of heart disease or other, vascular diseases like stroke, and trying to understand if we can identify other biologies that are involved. So for example, a couple decades ago, we were really involved in the development of an inflammation test to define cardiovascular risk. And that test is now used, every day to help decide who needs to be treated with cholesterol-lowering medicines and who might not need to be, for people who are in the gray zone, sort of. So if your cholesterol is like elevated but not too bad, and you don't have any high blood pressure or diabetes, and maybe you're middle-aged and not at huge risk, if your inflammation test is called CRP is high, then you should probably take that cholesterol-lowering medication, a statin. And so we're quite proud of our role in that work. That was a big collaborative effort, but the actual work of that really started here at UVM.
Great.
A while back. And so things like that are really fun when they
Absolutely.
happen. But of course, the research is kind of a slow process, and it's not every day that you find a new test that can be used in doctors' offices all around the world. But we are learning more about the causes by using biological samples from volunteers who we follow really for decades to try to understand their risk.
And you mentioned stroke a moment ago, and that's a little bit north of the heart, which is what we've been talking about with heart disease. So what's the correlation there?
Yes. So stroke and heart disease share a lot of risk factors. So for stroke, high blood pressure is the leading risk factor and driver. Diabetes and smoking are also important. Cholesterol is a little less important, yet the cholesterol-lowering medications are very effective at stroke prevention because they do other things. They lower inflammation, for example. And the other risk factors for stroke that are lesser risk factors for heart disease, but still important, atrial fibrillation is the big one. And so atrial fibrillation is where the top part of your heart is like jiggling like this instead of beating regularly. And when you have that, a blood clot can form in there because of the swirling around of blood, and it's kind of staying still. And especially if you go in and out of AFib, you can imagine if it's like this and you develop a little blood clot in there and then it starts beating normally again, you push that blood clot right out of the heart and it goes to the closest place, which is the brain. And that's a kind of a stroke, and it can be totally prevented if you have AFib or atrial fibrillation by treating with blood thinners. And so, if you're noticing fluttering in your heart or palpitations or lightheadedness or dizziness, then you really should talk to your provider about that to make sure that you don't have AFib, because the stroke is highly preventable in that situation.
And you have a helpful acronym to tell if somebody is having a stroke. What's B.E.F.A.S.T mean?
Yeah, B.E.F.A.S.T. So easy to remember, and I think the graphic is there.
Yep.
So B.E.F.A.S.T. B is loss of balance. E is eye changes, like visual changes or loss of vision in a segment of your vision. Facial, F is for face, and it's like face drooping. If you've ever known anyone who had a significant stroke, sometimes their lip is droopy on the side. And so if you have drooping of your face, flattening of the side. Arm, A is for arm. That's arm weakness, one of the more common signs of stroke. S is for speech, difficulty with speech or understanding what people are saying to you. So B.E.F.A.S.T, F-A-S-T. T is the fast part, right? Time is brain, and T is time to call 911. So if you notice these sorts of symptoms, you don't want to just pass it off, because the sooner you get to care, the more likely the treatments will be effective at preventing permanent damage to your brain.
Sure. So how fast should you be? Is there a time, or is it just as soon as you can?
Yeah, as soon as you can. And really, if you have paralysis or loss of vision or speech, this is not right. And so there's nothing wrong with calling 911. It's better than like getting in the car and trying to drive yourself to the hospital, even if you live close, because if you are in an ambulance, the emergency department knows you're coming, and the ambulance staff are highly trained, and they're going to know what's going on, most likely, and they can alert the team, because stroke treatments involve procedures that have to be done in a timely fashion. And the longer the time goes by, the less likely those procedures are going to be effective.
Sure. So you're saying that you don't have to have all of the letters before
absolutely
you
not.
reach out.
Absolutely not.
All right. And who's
Yeah.
at the greatest risk? We've said that everybody, it's the leading cause, but
Yeah.
is there anyone who's more prone?
Yeah, so age is a big factor, and then the AFib, high blood pressure, diabetes, smoking are the main things. So, and of course, if you have a family history of stroke or heart disease, then you're going to be at risk.
All right, and we've talked a lot about your research, and now we're going to give you an opportunity for a well-earned brag. UVM recently became an R1 designated, reached R1 status, I should say. So talk about how important that is to research at UVM.
Yeah, this R1 status is something that our prior president who left recently, Suresh Garamella, when he arrived, he said, "Why aren't we R1?" And we all looked around like, what is that? And it turns out, because I've been at UVM my whole career, never thought much about that. And it turns out that R1 status is sort of awarded to the highest echelon of research institutions by the Carnegie Foundation. And it signifies that you have well-rounded programs and well-funded programs and highly successful faculty. And when you have that designation, it gives you a reputation in the community. So it can make it easier to recruit the best and brightest faculty, because recruiting is tough. It's like sport out there trying to get people to move to your place. So recruiting great faculty and recruiting great graduate students and undergrads to do research and learn to be the next generation of us, it helps us to get high quality. So it's really very important.
Absolutely. Thank you so much for joining us today.
You're welcome. It's great to be here.
We're happy to have you, and that's our time for today. I want to thank the crew here at WCAX who always follow their hearts. I'm Jolie Whitney. This is Across the Fence. Have a good one.